Great. So today's webinar, titled Tackling Social Determinants of Health and Advancing Health Equity Through Community-Based Social Support Groups, is brought to you by Wider Circle. Wider Circle is an MHPA Silver partner and a longtime supporter of both the association and our health plan members. I want to thank them for pulling together today's content. Wider Circle will also be at MHPA's annual conference next month in Indianapolis. Please stop by and visit them at booth 412 if you ever want to continue talking or check in about today's session. With that, I will turn things over to Bill Friedman, Wider Circle's Vice President of Payer Engagement, for introductions and today's discussion.
Thank you, Eric. Appreciate it. Welcome, everyone, and I want to thank you from the entire Wider Circle team for joining us today. Today, as we talk about tackling social determinants of health and advancing health equity through a community-based solution, through community-based social support groups, we're going to talk a little bit about nuts and bolts. We'll talk a little bit about how we do what we do, how the Wider Circle solution works in the various communities in which we do work. And then we'll talk a little bit about the process, how we stand up the solution. But most importantly today, we're going to talk about what this actually means to our members. And I have a couple of guests with us today who are going to help us tell that story, help really get hyperlocal in the community, just like we do in our solution with our meetings. We're going to talk about the effect that we have on a few different members, and we'll bring those member stories to life. To help me do that today, I'd like to introduce a couple of our guests. One coming up first, Dr. Claude Pinnock. Dr. Pinnock, if you would introduce yourself, I'd appreciate it.
Thank you so much, Bill, and thank you everyone for joining us today. I'm Claude, the Chief Medical Officer of Wider Circle, and I'm excited to talk to you today about some of our member stories and also how the rubber hits the road in terms of the financial implications of our program. I will also hand it over to our other Wider Circle speaker, Ms. Jaquila Harrison, to introduce herself.
All right. Thank you, everyone. My name is Jaquila Harrison. I'm the area manager for Michigan here at Wider Circle. It is my pleasure to introduce myself to you and who Wider Circle is, and also our members, how we've affected their lives, and the joy that I get in being a part of this amazing organization.
Thanks, Jaquila. Appreciate that. And I'm Bill Friedman, again, our Vice President of Payer Engagement. My organization, my team here at Wider Circle leads our relationships with payers nationally. We've been very active in MHPA, and we look forward to seeing all of you at the conference coming up next month. So for our first step today, let's talk a little bit about who is Wider Circle, what we are, how we do what we do, and a little bit about the nuts and bolts of the solution. First of all, we've been around for about 10 years. This isn't new. Our Connect for Life program, which is what we're going to dive deeply in today, is currently available across the country in 5 languages in thousands and thousands of communities. One of the most beloved parts of Wider Circle is that although we are tech-enabled and we leverage technology in our daily lives just like you do to manage our business, we are really about people. We are a people-first solution. We're about connecting with your members. We're about connecting your members with other members, creating relationships. That all starts with our 400+ team members across the country and the thousands of peer ambassadors that we have. Peer ambassadors are your members who are out there in the community, who understand the local culture, the local customs, speak the local language, and help us bring this solution, help us connect members to other members to rise that healthcare tide for everybody. As part of our process, we do this for companies across the country. You can see some of those logos on the bottom of your screen. But we don't do this just to make everybody feel good. That's part of it. We do it to improve quality. We do it to improve health outcomes, and we do it to really rise the tide on member experience and create a greater bond between that member and another member, and just as important, between that member and their health plan. So what do we do at Wider Circle? Well, our Connect for Life solution, first of all, helps close care gaps within the payer ecosystem. We introduce members to your high-value programs. We drive higher HRA and annual wellness visit completion. Our program is a proven program to reduce inpatient admissions. We improve HEDIS measures, such as cancer screenings and diabetes. We show incredible improvements in retention and in alignment for those who are dually eligible and potentially have different Medicaid and Medicare plans. We help align those folks. We reduce social isolation and loneliness, and we help members address SDoH hurdles and help refer to them to appropriate resources in the community. We close that loop and we feed that data back to our plan sponsors. A little bit about the program and how it actually works. Well, you're going to hear this word come up a few times today, and it really is the foundation of the Connect for Life program. It starts with trust, building trust hyper-locally in the community. Without trust, it's really hard for a member to receive a message. If you call a member up, and I worked on the health plan side for many, many years. I led sales. I was chief sales officer for a couple of different health plans in the government program space. We make a gazillion phone calls a year, but getting a member to open up and talk to us about what's going on, complete an SDoH survey, complete an HRA, takes trust. If not, everybody says everything's great. So the first thing we do is build that rapport in the community. That starts with our employees, our facilitators who live locally in the community. And again, speak that local language, are familiar with the local customs, understand the needs of that community. We do this both hyper locally, we do it physically on the ground with local meetings, and we also do it virtually. We bring folks out for fun, for engagement. We don't call folks up and say, hey, come learn about why it's important to leverage your PCP and not urgent care or the emergency room. Or we don't call them and say, hey, come on out and learn why it's important to get a colorectal screening. We tell them, hey, come on out and meet your friends, meet your neighbors. Let's kind of let our hair down a little bit. Let's get to know each other. Let's build a relationship. And once we have that trust, then we can almost prioritize any initiative that the health plan has. Over time, we build in to those meetings a healthcare curriculum focused on proper utilization, the members' benefits, SDoH, connecting them to local resources, closing that loop, and how to be more proactive about their healthcare. All of that is built around creating this circle of trust with your membership. So we have our own call center. We reach out. We're doing direct mail. We co-brand with our plan sponsors. We identify those SDoH challenges once we have that trust, connect folks to resources, and then through direct action with that member, help move the needle on HEDIS measures, make sure referrals are made. We circle back with the member to make sure that they've had their medication reviews, they're getting their durable medical equipment, they have a PCP, and they understand how to leverage their healthcare ecosystem to make sure that their healthcare tide is rising. I wanted to play a little video for you because it's one thing to hear me say it. I'd like you to hear a little bit from our members.
The mission of Wider Circle is to connect neighbors for better health.
Our well-being, our happiness, everything is just linked to our community and to our neighborhood.
Everyone needs somebody to lean on, and that's really what joining Wider Circle is, an invitation to be part of.
We read over 600 publications that looked at the science. Being together in a community is critical to our health.
Before I joined Wider Circle, I was home every day, just about, doing not much of anything. Then we started doing activities, and then I got myself moving, and I got off the couch. We just had a great time.
We found some good friends. being in the group is just all the time it's happy. We have a lot of fun together.
It gives me something to do, get up, do yoga and, get the bones working. It's pretty good. I like that.
Neighborhoods in which we've been operating for a while look different. Neighbors know one another more, say good morning to one another. If there's a senior living on the block, he's not alone on Thanksgiving. People knock on his door, bring in turkey, say how are you?
I got sick, and I got sick with COVID, and my entire family in December. Members left food outside my house, and it was the most wonderful 2 weeks that we had because the food was delicious. That was an amazing experience that we had, how much love there is in the community now, and I feel the same way for them.
A cardiologist came to speak to us, an ophthalmologist came to speak to us. We even had a meeting on estate planning. So you're learning and having fun at the same time.
No le damos chance a la vejez ni a la depresión, porque vamos combatiendo eso con la alegría de compartir todo.
I see members' faces smiling, getting healthier, socializing, and that brings me happiness.
If you have somebody that's kind of hesitant to join, basically I tell them, just come to a couple of events and just see how much fun we have.
Nos mantenemos jóvenes, always happy, always young.
So to talk a little bit more about wider circle in the community and how we connect neighbors for better health. And we do this, by the way, in multiple lines of business. So we do it with dual eligibles. We do it a lot in Medicaid, Medicare as well, to really kind of dive into how our program works in the community with Medicaid members. I'd like to bring back Dr. Claude Pinnock and Chiquila Harrison, our facilitator, our facilitator manager in Michigan.
Thanks so much, Bill. So as Bill mentioned, we're going to do now is actually take a much deeper dive into 3 specific member stories in the format sort of a live Q&A between Chiquila and I. Chiquila is one of our wonderful area managers who's actually on the ground working with these folks day after day. So Chiquila, our first story is about Dontasia. So why don't you start by telling us a little bit about their background and experience?
Awesome. Dontasia really is a reflection of the video you just saw. With her, she had suffered through a lot of hardships in her life. She had 3 surgeries on her left arm, and her mother was her caretaker. And as we know, as a mother is to their child, it's a responsibility that you don't have to pay to do. However, they were facing a lot of financial strain. So I called, just to check up on them and see how they're doing. And her, just to be honest with you, the mother was like, "Why are you calling me?" And I let her know who Wider Circle was. I let her know who I was. And I said, "You know what? I would love for you to come out to an event." So she said, "Well, I don't come outside." I said, "Okay, well, join my virtual event." And I like to kind of sneak the spinach in with the dessert. So I might do a bowling event, but I'll put bowling for joint health, So I said, okay, bingo, but it was health bingo. So the mother joined because she wasn't quite trusting with us to allow her daughter to join. Then I noticed her daughter spoke up, and she had kind of let me know that her daughter was mentally delayed. So I said, okay, because I would host trivia events. I said, I'll put some easy questions because I just wanted her to integrate herself with other members. When I tell you, when we had our trivia event, Dontasia knew all the questions. I went from just saying, okay, what, is this if you go to your doctor's appointment, to looking up things from Jeopardy. She knew them all. And I was amazed, and her mother was amazed. And then she started attending more and more events, but I noticed they were just virtual. She was engaging with the members. So I said, Dontasia, how would you like to come to a movie event? And at first, the mother kind of told me, well, her concerns about her daughter, because her daughter walks with a limp and has some scarring. And I said, well, I tell you what, you get there early. I'll be there to accommodate you. And I had my ambassadors there as well. And this is the first in-person event that they came to. the first movie event of just going to the movies in the past 10 years. And they were looking around and everything. I was there to greet them, and I just welcomed them with open arms. My ambassador spoke to them. We kind of, went and picked out a movie that was appropriate, and I had tears in my eyes. Her mother was crying, I was crying, because we knew what step this was for her. And especially a mother with their child. No one wants their child to be made fun of or bullied. And she has suffered a lot of that in her life. The area she lives in is very crime-ridden. And they could not find places that was safe for her to attend. So Wider Circle opened that door for her, and they've been nonstop coming to events ever since. So I love this story.
Well, thank you, Shakila, for sharing that. You touched on this a little bit, but you mentioned in terms of quality of life and income of the family. Was Dontasia's mum able to seek resources through Wider Circle as well to sort of help with some of those social drivers?
Yes, she was. We have our facilitators that have a caregiver circle, and that circle is just for members who are caregivers or have caregivers in their life need assistance. She's a mom, nobody has to pay you to take care of your child. However, in dire needs, you need those expenses met. So we were able to set her up with the resources. She attended our caregivers resource circle, and now she is being paid. So through the state to get those resources, as well as a lot of programs that was needed in order for her to take better care of her child. And that was through Wider Circle. And she loves us for it. We were able to help her every step of the way. We were able to find her legal aid and things like that, and to assist her in the process. So now she's officially her daughter's caregiver. She doesn't have to seek other resources or anything like that, because her needs are being met to take care of her child.
Thank you, Shakila. And I think this story is a great example of the importance of trust. Like, we built that trust gradually, and we were able to, through that trust, identify like key resources for this member that they weren't aware of, and actually not only just improve social quality of life, but actual financial quality of life through getting them access to those resources. So that's Dontasia. Should we go on to member story number 2, Tashwanda?
Yes, we can. All right, this is Tashonda. I love this story because she was tackling a lot of health issues. She's a single mom. Of course, she suffered a lot of hardships, and we called her, as we do, and we said, hey, we would like to invite you to one of our events. And one of the things she wanted to do was reclaim her health back. And when she saw our events on health and fitness, of course, she jumped right on board. And what I loved was, because we had our ambassador, her name was Shalita. And during the walk, she's with a walker. I don't know if you guys can see her, but it was kind of a rough journey for her. She wasn't the smallest person. She was one of the largest. But when she was able to connect with our ambassador, Shalita, who told her, hey, I lost 100 pounds through walking, and you'll be able to do it too. That gap, I know, it just lit a fire in her. She said, no, Miss Shakila, I'm going to come to every event. And Shalita said, you know what, whatever it takes, I'm willing to work with her, and I'll make sure to be her guiding light. Because a lot of times shame is what hinders a lot of our members, or people in general, to making those difficult health choices. They don't want to be criticized. They don't want to be judged. And that Wider Circle, what I love about our leaders, they kind of let us know, hey, we're going to meet you where you are. You are here. We won't judge you for that. However, we want to work with you so you can make those quality of life changes. And that's one of the things that was implemented from the top on down to us, is that when you greet the members, always show empathy and compassion, and give them the tools and resources so they can come out of that shame and make better choices in their life. So yeah, I love this story.
Yeah, that's awesome. And so you mentioned she had these weight loss goals. How's it going? Where's she at now in terms of achieving them?
Well, when I tell you that she came to me and she said, you know, it's been a while since I made a wellness checkup and I needed a PCP. And I was like, well, of course, let me sit down and get everything down for you. So she was able to make her wellness checkups and her doctor appointments, everything that she needed. She met with a nutritionist, and right now she's down 38 pounds. So
Awesome.
this picture, yeah, was back in May. So now that we're in August, she is already shedding the weight. She says she's gonna next year, she wants to do something with Wider Circle where she can kind of advocate for other members and kind of tell her testimony. So she's making those changes, and that's what Wider Circle, why I love working for Wider Circle, is that they're here to promote the member in making better choices at one step at a time. So yeah.
That's awesome. We can do a before and after if she's up for it.
Yeah.
So the other thing you mentioned is she's a single mom.
Yes.
And being a mum full stop is a hard job. Being a single mum is even harder. And then when you're trying to look after your health, there's often not enough time, etc. So how did we give her the resources, or what resources has she been able to utilize as a single mother for her children?
Well, like I said before, you know, in order for us to kind of speak to the member about their health, we do have to meet them in their needs. And one of the needs that she needed was housing, and her son. She's been braiding her son's hair because she couldn't afford to get her son's haircut. So Wider Circle is hosting a back to school event, which is coming up August 17th. And when she found out we were going to have licensed barbers and braiders who are volunteering their time because they want to help, you know, give the children a good start as far as going back to school, she was so happy. She said, yes, I finally get to get his haircut. We were looking through the books at different hairstyles and everything like that, and he was elated, you know. So it just gives that self-esteem back to a child starting their first day. I'm sure everybody can kind of remember how their first day was.
Yeah.
But I can tell you, it's something when you are set up for success, opposed to she was braiding his hair, and I did see his hair. She was doing the best she could. But it's, you know, children can be cruel. So Wider Circle, helping her with that, she was so happy with.
Yeah, and those small things really make a difference and help build generational trust as well, which we've seen is really important. So final member story, Joel. Tell us a little bit about Joel.
Well, you know, Joel is a unique case because at the time he did not have any health challenges, anything like that. However, he was very isolated. He was a man that wanted to connect in his community, didn't quite know how. He would attend our local food giveaway event that we had every Thursday. And at one point in time, it was a delay in the truck getting released. You know, this distributor, so this facilitator was trying to hurry up and get everything set up. As soon as he saw that the facilitator had started unpacking things and volunteers, he ran up there immediately. And my facilitator had to take a picture of it. And he was getting in, he was helping unpack everything, set everything up. And then he offered to help to take the boxes to the members' cars. I think that's something most people don't consider when they're going to a food giveaway. So my facilitator said, hey, you look like ambassador material, something like that. Can I please take a picture? He, of course, gave his consent and was proud to pose. And ever since then, every Thursday he shows up there. I've even been there at a few Thursdays myself, and I was like, hey, Joe, how are you doing? And he was very proud to represent and advocate on our behalf to other people in the neighborhood. So Joe's an amazing man.
That's awesome. And it's really heartwarming when folks who have so little still are able to give so much through small gestures. You know, what's the biggest takeaway he's received in connecting with his community? Like you mentioned, he was isolated. So what's been the biggest takeaway there?
His biggest takeaway has been, for one, becoming an ambassador, feeling like he belongs. A lot of times people feel better about themselves when they have a title, you know, as an ambassador is, but just knowing that what they're doing is not going unnoticed. He is more sociable. The last time I spoke to him, he said, hey, I spoke to a couple of members. We're thinking about, you know, going out and cleaning up the streets. And I was like, okay, well, let me know if there's anything I can assist you with, the bags or anything you may need. And he said, for sure. So I was like, okay, for sure, that's fine. And he's been reconnected through the community. He goes and he walks around whenever, if he sees anybody, you know, that may seem lost, he's a lot happier. And he said he's very grateful for Wider Circle. Like I said, he doesn't have any children. He doesn't have siblings or anybody in his life that he can make those connections already have. So he has used Wider Circle as his family. So he calls me sis when he sees me. And I'm like, okay, bruh, you know, and that's what I love to see, the transformation with our members when we bring quality to their life. You know, we can all live on this planet, but who lives a quality type of life? He does, and Wider Circle was a part of that quality for him.
That's awesome, Shakila. So there is like a hidden fourth member in the Wider Circle family. I'd like to ask a few questions, and that is, of course, you, Shakila. You know, talk to me about, you know, you're part of our family, you're part of our community, here, which we're very passionate about. Talk to me about your sort of personal experiences and motivations working in Detroit and in Michigan, and what led you on your journey with us.
Okay, well, I will tell you, I started off with a background in nursing and patient care tech and a phlebotomist. They called me the little mosquito lady. I did it, but I didn't like it. However, my passion was always in culinary arts. So I said, you know what? I'm in my late 30s. I'm going to enroll in culinary school, which I did. I'm a French trained chef. I wasn't making the money that I was as a nurse, but I was like, you know what? I'm living my best life. And as everyone knows, when COVID hit, it knocked the wind out of the restaurant industry. I was an executive chef. And I said, you know what? I can't, you know, my passion has become begrudging. I can't do it. And my sister is already here working at Wider Circle. And she said, you know what? Why don't you come over here? And I was like, okay. And I did. I started off as a canvasser. And I was knocking on doors and, you know, my cheery self, but I did notice some of those doors were not the doors that I was used to being on. A lot of those doors had Confederate flags on it, because in Detroit, there is the inner city, and then there is the downriver area. And I like to say those are our Make America Great Again people. And I was knocking on doors, and I was, you know, finally, you know, gaining the trust in the area. And I said, okay, it's time to host events. And the first thing I said was, I was not hosting any segregated events, because I had my Black Lives Matter members and my Make America Great Again members. And I said, well, what is the common thread that I can bind these two diverse groups with? And it was their health. All of those members were type 2 diabetic. So I hosted my first event, and at first they both kind of started on both sides of the room. But once we started talking about their health, and I noticed that everybody had questions, and then I wouldn't just blurt out the answer. I would say, so Mike, what do you think DeJuan's answer should be to that question? And I started allowing them to engage. It was scary at first. However, the Wider Circle rules prevailed. And next thing I know, they were talking about going fishing. I didn't know how that would look. However, the bonds were made. And now I am proud to say that because I stood on the principles of Wider Circle, I stood on my principles as a person, that I was able to graft those members in, and that was the common bond, their health. And I've loved it ever since. Wider Circle has allowed me to host online cooking events for health and nutrition. They allowed me to incorporate my passion into my work. And I'm going to tell you, that's what we bring to every member. And when you're passionate about something, you get excited and you love to do it. So,
That's awesome. And for everyone listening, as you can tell, Shakila has solved the great modern political divide in society as well. So she really should be moving up in the world. So there's one more question I want to ask. There's one more question I want to ask you, Shakila. And this is actually a story you told me once when we were chatting on the phone. And it's around the importance of And I think what makes you so successful and good at your job is that you have lived and breathed that neighborhood. So if I swanned into those areas and was like, I get what you're going through, everyone would look at me and be like, no, you do not. But you actually understand the neighborhoods. And I wanted you to maybe give me an example of that story you told me about the Wesley Snipes movie and like the importance of like trust and all that stuff, like how that sort of knowledge of so Shaquila's got what I would call like this hyper-local cultural competency, and we're trying to build trust. So we need people with that in order to do so. So maybe you just do a quick monologue on that, and then we'll move on.
I will. Okay, so what people don't know, back about 15, 20 years ago, they decided to do a sting. And what they decided to do was invite everybody that had warrants and said, hey, Allen Park, they had just built a studio. They said, we need extras to come and star in a movie. We'll pay $250 per day. So everybody started showing up. But when they got there, it was just a big room with chairs. And then once they had, I guess, the 250 people, 300 people that they had reached out to, they locked the doors and said, no, this is not for an audition for a movie or a stand-in. You all have warrants and you are under arrest. And it, of course, blared all over the news. And from that day forward, that stigma lied as far as with people calling about auto insurance scams, everything like that. That has always stuck out in our community. So, of course, it made it quite difficult. However, because we are a part of the community, like us, I'm from Detroit, born and raised, I was able to reach out to the members in a way that they felt comfortable with, and I allowed them to ask their questions. And it was difficult. However, when you work within that community, it is very important to get what the community, the people of that community and what they look like. Because not only am I an advocate for the members, I'm an advocate for wider circle for the insurance companies I'm representing. And I was able during that time to break down a lot of stigmas and barriers and things that I know was a hindrance for us connecting with our members. So yeah, that even to this day, and that was like 20 years ago. No, you're not. Oh no, you're not going to get me arrested. I'm like, no, I just want to help you engage back within your community. I'm not, So that's one of the things that really stuck out with our Detroiters. Yeah.
Yeah, and having that knowledge and being to approach folks on that level, I think, has been crucial to you being successful. So look, I want to thank you, Shaquila, for taking us through those stories. So thank you so much. We're going to move on and change tracks a little bit now to talk about impact. So thank you, Shaquila. So now you've all heard and understood at the member level our impact. We need to bring it to the macro level in terms of the impact the program has on the bottom line as well. We all live in a world where dollars are spent and there are only a certain number of them. So how is Wider Circle going to tangibly improve quality and save money and deliver the ROI and reduced cost? So Bill, if you move to the next slide, I want to just spend a very brief amount of time that I think it's worth doing is explaining in brief how we arrive at the results I'm about to show you and share. One of the things we have is a very robust data architecture and longitudinal claims that allow us to not only match members together like in the diabetes group that Shaquila mentioned, also it allows us to conduct rigorous scientifically sound studies that mimic best-in-class actuarial studies. So our results are actually uncovered through conducting what's called retrospective cohort studies. And what that means is from a historic time point, we follow individuals who have been exposed to the intervention, the Wider Circle Connect for Life program, and we follow a similar control group over that same time period. And then in order to ensure the participants in each arm of the study, if you will, are as similar to one another as possible, we use something called propensity matching with a really narrow caliper. What that means is we're doing an apples to apples, a like with like comparison. And this allows us to look at both groups' pre and post values and assess a difference of differences with minimal selection or recall bias. So great that I'm telling you all this, but we were so confident in our methodology that we actually invited the experts, Milliman, to conduct a review to assess the appropriateness of it for quantifying our impact. And we've linked the full report, but essentially they found that the methods were reasonable and appropriate and consistent with typical actuarial practices, which is the type of effusive language one can expect from Milliman. They essentially speak for saying, we're doing the right thing methodologically. So all the results you're going to see are using this kind of methodology. So let's actually show some of the results. So I'm delighted that we don't just do little white papers around our results, we get them published in peer review as well. So this is a study using that methodology in an African-American Medicaid population in Michigan, same population Chiquila works in. So this is published in the Archives of Public Health. It's in open access if you decide you want to go and find it, and we can also send you a link afterwards. But the key points here are we showed $115 in cost savings for every engaged member, and either maintained or improved quality metrics, such as with the adult access to preventative and ambulatory healthcare metric. So next study, same methodology again. Look, we know maternal health is very variable in the US. Maternal health and maternity care is universally important for Medicaid, no matter what state you're in. So the idea here was to take our usual program and adapt it around grouping pregnant mums by due date. And that shared lived experience in combination with mixing first-time mothers with mums who have multiple kids could create a really nice social dynamic and positive deviance with more experienced mums speaking to less experienced. We also have multiple generations in these groups quite often. So we tailored the content around specific perinatal content, and the feasibility study results were great, which have been submitted to the Journal of Feasibility Studies, pilot and feasibility studies, apologies. And whilst our N was small, directionally, we showed really good improvements in solid perinatal outcomes like C-section rates, low birth weight, preeclampsia and eclampsia, all of which are significant cost drivers. And we're going to keep running this and increase the N, because it turns out it takes 9 months to add one to the study pool to show impacts on harder outcomes. Next study. So this is a large-scale 10-state DSNP engagement. 4 points to make here. First point, we had universally great engagement nationally across these 10 states, with a whole eligible member across the whole eligible membership, with a state high of 22% in Texas. Second point, we reduced member attrition, voluntary member attrition, by a third. This is one of the key value drivers Bill mentioned earlier. Thirdly, we also drove value through preferential utilization patterns, such as you see here, and reductions in acute inpatient. And fourthly, we unlocked value through risk adjustments, through annual wellness visits and HRA completions. This is one of our successful rollouts. And the other thing that is worth touching on here, and I know Bill will go into more detail around with regards to implementation, common question we always get, are you in my state? Even if we're not, it doesn't matter. We did this in 90 days, 10 states, 90 days. We've got this highly templatized approach so that we're able to roll this out at scale. And our final study for the day, if I hand it back to Bill, these are some examples of how Wider Circle has been able to align our program with plans initiatives to better scores and better outcomes in key domains. So this is a national multi-state Medicaid MCO. And what we saw was improvements between control and intervention in key quality metrics, again, using that same methodology. The adult access to preventative screening across both age cohorts, 20 to 44 and the 45 to 64. Improved flu and diabetic eye results, and improved cervical cancer screening rates as well. And you can see here some of the C-section rates we were also able to achieve with that multi-state Medicaid MCO. So look, I am happy to chat asynchronously over email, one-on-one with anyone again to take a deeper dive in our program, numbers, studies, take questions at the end. But for the moment, I'm going to hand it back to Bill to summarize us and talk about implementation. I'm looking forward to Q&A, and just thank Chiquila again for a really great Q&A there. So Bill, over to you.
Thank you, Claude. Thank you, Chiquila. Appreciate it. Just a couple of things, just kind of encapsulate what we've just heard. What makes Wider Circle different? What makes it unique? You heard the word trust. We leverage claims data to drive desired behaviors and actions because we have that trust. We develop those lasting and meaningful relationships, build a consistent circle of friends, neighbors, and resources, sustainable communities for your members. The idea of Wider Circle is not that someone has somebody in an acute emergency. It's that they have a resource. They know a neighbor when they need a light bulb change, they need a ride to the doctor. They have that community around them, not just maybe the hour a week they spend with us virtually or in person in one of our meetings, but they take that home with them. What we do is recurring. It is consistent and becomes part of that member's life and part of their routine. Once members are coming out to our meetings, once they're joining us virtually, and they are accustomed to meeting with their new friends every week or every month, it becomes an important part of their life. Therefore, they're more trusting, more receptive to the message, and it builds that tremendous, as Claude mentioned, increase in retention. Because if they leave your company, if they leave your MCO, then they can no longer be part of our meetings. And who doesn't want to meet with their friends all the time? Our facilitators are fully trained, they're fully vetted, background checked, they are employees of Wider Circle. And of course, as you heard, we do this to help members meet their goals, to close gaps, address SDoH, and we do it all with a very, very measurable and scientifically determined ROI. Needless to say, to stand this up, we need your data. Because of that, we are high trust certified, trusted by some of the largest managed care organizations in the country. Dr. Pinnock mentioned that we stand this up quickly and simply. One of the really nice things about the Wider Circle solution from a health plan perspective is we do not suck up a ton of health plan resources. We are doing virtually 98% of the work to launch this solution, which is how we launched 8 states in 90 days back in Q4 of 2022 for a national plan. People always ask, well, how do you work with our existing community health workers? How do you work with our care management teams? We do local events every now and then. We work with your teams. We're not there to replace your teams. We're there to supplement your team. So your case management program, your nurse case managers, your clinical team, they're going to come across folks that would be great candidates to be in the Wider Circle program. We will build that referral pathway. We are going to, in our outreach and in our engagement, come across folks that need deeper case management. We're going to refer all those folks back to you. Needless to say, we do this with a degree of quality, not just on the clinical side, but in a feel-good side. We are beloved by members, and therefore we make the plan beloved, more beloved by our members, and we have an overall 88 NPS score to prove that. So that is our planned presentation for today. You've heard a lot about the program, the nuts and bolts. You've heard about some of the impact in the community. If you just shoot me an email, we're happy to share this deck with you, and we'll share our contact information in a moment. We're happy to asynchronously talk about the results and talk about any needs or how we can potentially help you. And at this point, I really appreciate your time, and we're happy to open the floor and take any questions you have. You can see there is a chat function here, so please, if there are any questions, feel free to post them within the chat. I see a couple of questions already posted, so maybe for you, Claude, I'll pass this out to you. What criteria do you have for your community health workers? Do they have to be community health workers?
So they don't have to be community health workers is the first thing. It depends on the states and the legislation that is present. But regardless, the profile of our candidates is pretty much identical to community health workers. So there is a national curriculum for community health workers called the 3C National Curriculum, and our Wider Circle University has a 100% overlap with that curriculum. So we train our folks in that curriculum. And I'm also delighted to say, I think just a couple of weeks ago, we were actually formally certified in the state of Michigan as being a CHW accredited training school as well. So we're actually listed on the website of MISHWA around that. So yeah, that's the status there.
All right. I see another question in here. Big compliment for Jaquila. Someone said that you're an absolute inspiration. But the question here is, how does Wider Circle define KPIs? And how do you map engagement to ROI for plans that you're partnered with? So basically, how do we report back, right? And how do we define what those key performance indicators are for the plan? Maybe Claude, you're best at answering that.
Yeah, so the first thing is any conversation around SLAs, essentially in a contract, we will have with the plan and ensure that we're all aligned and that what we can do can actually, first of all, be attributed to moving the needle on that thing, and is also a priority for the healthcare plan. Then in terms of how we define them, we use standard clinical or PMPM-based definitions. So we work with the health plan's actuaries to make sure we're aligned on that, and then we report out in that exact fashion. So using those same definitions. The methodology we use is the Milliman methodology that I articulated before to quantify our impact and show how we are moving the needle in those areas. And then Bill, I think there was a third part of that question. Would you mind repeating it for me?
The third part of that question.
Or maybe I answered it all.
I think you answered it already, but I do have a follow-up question for that. Mm-hmm. Can you elaborate a bit about how you link claims data to SDoH risks?
Okay, so I'm just want to make an assumption in terms of my interpretation of that question. So if the question is asking, how do we use the data we capture on SDoH as part of the ROI analysis? We do large scale surveys of members for SDoH needs. That's actually one of the ways we build trust initially. When we reach out to members, we do a sort of a quick SDoH screen and then help them with something. Because there's nothing like helping someone with something and actually following through on it to build trust. So that's how we're sort of linking it to the individual claim ID. And then, of course, we use Z codes or Z codes, depending on where you like to pronounce your language from, which are specific SDoH-related codes that are sometimes crop up in the claim. And we use those as well to help with our member clustering and identifying common issues that the members may have.
Thanks, Claude. There's a question here, a couple of questions about what states we're currently working in. So currently we work in 15 states. Without reciting them all, the real key message here, and Claude mentioned it earlier, we have the ability to stand up a state in under 90 days. So just because we are not in a geography currently is not a hindrance to us launching that geography efficiently and quickly. We have a very, very templated approach that has been repeated time and time again in those 15 states. So whether we're in your state or not, it really is not a challenge to stand up a state quickly. That being said, happy to discuss exactly what our geography is offline at any time at your convenience. So please shoot us an email. You can see our contact information right up here on the screen in front of you. There's another. I'm sorry.
Sorry, Bill. There's a good Bill question I just see popped up here. First of all, thank you, Elizabeth, for your comment on the neighborhoods. But she's asking around payment structures and how we serve neighborhoods with different payers, one, and then how payment is structured from that payer per service, per member, per neighborhood. So maybe you could speak to that.
Sure, absolutely. So we have a few different revenue models that we work in. In general, our program is, even though there are multiple payers in communities across the country, our contract is typically with a specific payer, and we keep our meetings focused on that payer, right? So it's about that payer's initiatives, that payer's retention, that payer's member experience. So we don't typically cross-pollinate. We might, if we work with multiple payers in an area, and we do, we have separate meetings for each of those payers. As far as the revenue model, our standard revenue model is a small PMPM for the membership. We then build SLAs and key performance indicators, KPIs, that we incorporate into the contract to guarantee performance. That's in Medicaid. If we're talking about dual eligibles, D-SNP members, we change that a little bit, and we do add a risk component into that. That being said, there's a lot of flexibility in our model, and a lot of it depends on the MCO's specific initiatives, the goals, or is it improving HEDIS measures? Is it improving retention, member experience, medical cost spend? You name it, we can incorporate almost anything into our contract. So we look forward to having the conversation with you and coming up with something that's specific to your needs. I see one additional question about American Sign Language and about the languages that we deliver our program in. And yes, currently we deliver in 5. Languages are really one of the simplest things for us to stand up. And I don't see any reason why we could not deliver the program in ASL if that was a requirement. So we're certainly happy to have that discussion as well.
And Bill, just to add to that, I just looped with our internal team, and I believe we have, where there has been a need previously, looked into hiring actually a sign language interpreter and bringing them to an event for specific members before. So we want to make sure our events are as inclusive as possible. So even if it's not a group of individuals who are hearing impaired, if there is one individual who is, we want to make sure that the event is accessible for them. So we will accommodate them accordingly.
All right, fantastic. So I think that was our last question. And I want to just thank you all for joining us from the bottom of my heart. I know I speak for the entire Wider Circle team, not just for the folks on the call today, that building these communities, that creating this type of engagement locally in the various communities of the country is some of the most vital work, and it's near and dear to all of our hearts. So thank you so much. I know it's important to you, otherwise you would not have spent the last 60 minutes with us. If you are attending the MHPA conference next month, please do stop by booth 412 and say hello. I'll be there. I believe Dr. Pinnock will be there. And you have our contact information in front of you. Please use us as a resource. Feel free to reach out, ask questions. We're here to be a resource to you. So thank you very much. Thank you to MHPA. Thank you, Eric, for facilitating the program today. And thank you to Chiquila and Dr. Pinnock for being my co-hosts.
Thank you, everyone.
Thank you, everyone.
Have a